If your knee hurts every time you squat, take the stairs, or even get out of your car, you've already been lied to. People tell you it's just aging. Doctors tell you it's normal after 40. It's not. In most cases, your knee isn't the real problem at all. Today, we are going to show you the one root cause behind most knee pain in men over 40 and the 3 fixes that start reducing pain in days. Not supplements, not surgery, actual relief you can feel fast. Most men think knee pain starts because the knee is old. That's the biggest misconception. Your knee hurts because the muscles that are supposed to support it have slowly weakened, tightened, or stopped firing properly. After 40, you lose strength in the quads, glutes, and hips faster than you realize, especially if you sit a lot or train the same way you did in your 20s. The knee is a hinge joint. It does not control itself. When the muscles above and below it fail, the knee takes all the impact, all the instability, and all the wear. That's why you feel sharp pain when going downstairs, stiffness when you get up in the morning, or that deep ache after a workout. The joint isn't broken, the support system is. And here's the part most men miss. The pain usually doesn't come from damage, it comes from imbalance. One side of your leg is tight, the other side is weak, and the knee sits in the middle getting crushed. This is why icing, stretching randomly, or avoiding leg day never fixes anything. Your knee doesn't need rest, it needs the right muscles to start doing their job again. As you age, your upper leg muscles, especially the quads, hamstrings, and hip muscles, tend to weaken or lose coordination. That weakness doesn't just affect strength, it directly impacts your knees. Studies show that people with stronger quadriceps and hamstrings report less knee pain and better mobility than those with weaker legs, even when joint damage is similar. Why does this matter for you after 40? Because muscle strength naturally declines over time. That means your knee joint ends up taking all the load instead of being supported. The cartilage, ligaments, and tendons bear the full burden. When quads are weak, the kneecap, patella, often tracks poorly during movement or weight bearing, creating tight spots, rubbing cartilage, or uneven pressure, especially on stairs or after sitting. That causes the stabbing pain, grinding, or stiffness many men call just old knees. The good news? This is fixable. Strengthening the quadriceps, hamstrings, and hips reduces the stress on your knee joint. Research shows that better leg muscle strength correlates with less pain and improved daily function, even in knees with osteoarthritis or chronic wear. So if your knees hurt, don't treat it like age. Treat it like weak support under heavy load. Fix the support, protect the joint. One of the most effective and research-backed ways to relieve knee pain after 40 is simple. Build strength and stability in the muscles around your knee. A well-designed exercise routine can reduce pain, improve function, and protect joints long-term. Here are 3 powerful fixes you can start today. 1. Quadriceps strengthening. Knee extension, isometric hold. Studies show that strengthening the quadriceps, either with isometric contractions or controlled knee extension exercises, significantly reduces knee pain and improves mobility. Do 3 sets of 12 to 15 reps, or 30-second holds, 3 to 4 times per week. This helps the quad absorb shock, instead of letting the knee joint absorb it. 2. Hip and glute strength. Hip abductions, glute bridges, side steps. Stronger hips mean better alignment and load distribution, reducing stress on the knee. Clinical evidence shows that adding hip muscle work to quad training boosts pain relief more than quad work alone. 3. Stability and balance. Fix weak links, improve control. Strength plus stability is the key combination. Weak hips or glutes often lead to improper knee tracking and instability, a major source of chronic knee pain for men after 40. Do this simple mini routine 3 to 5 times a week, no fancy equipment needed. Consistently doing these 3 fixes improves knee support, decreases pain, and delays or prevents further joint degeneration. Excess body weight isn't just cosmetic. For your knees, it's brutal stress. Every extra pound of body weight magnifies the force on your knee joints. Just 10 extra pounds can translate to 30 to 60 extra pounds of force with every step. When you're over 40, cartilage is less resilient, muscles recover slower, and inflammation lingers longer, meaning that extra load doesn't just compress your joint, it accelerates wear and degeneration. Research consistently shows that even modest weight loss lowers joint stress, reduces inflammation, and improves knee pain and mobility. In one large, long-term study of people with knee osteoarthritis and obesity, combining weight loss with exercise led to measurable reductions in pain and better function compared to control groups. It's not just about less pressure. Carrying less weight also reduces inflammatory signaling tied to fat tissue. Fat doesn't just sit there. It secretes inflammatory molecules that degrade cartilage and worsen pain. So if your knees hurt, especially if you've gained belly fat or body weight over the years, dropping as little as 5 to 10% of your weight can dramatically reduce pain. Think of it as reducing wear and tear per step. Less weight equals less load equals less pain. Your knees don't need to be babied with rest. They need regular movement, the kind that keeps lubrication flowing, cartilage nourished, and joint mechanics smooth. When you flex, extend, or gently load the knee, walking, light squats, mobility drills, you stimulate production of synovial fluid and lubricants like lubricin and hyaluronic acid. This fluid acts like oil in an engine. It reduces friction, feeds cartilage, and cushions bone-on-bone contact. Research on joint disease, like early osteoarthritis, shows that exercise training, anything from joint mobility drills to moderate aerobic activity, improves pain, stiffness, joint function, and slows cartilage/bone degeneration. Good joint nutrition plus motion equals delayed wear. Here's the simple daily strategy men over 40 should follow. Morning joint wake-up. Gentle flex-extend cycles, ankle/hip/knee mobilizations, 2-minute flow. Light weekly load, bodyweight squats or controlled lunges. Regular moderate activity, walking, cycling, swimming, to keep circulation and synovial fluid moving. Do this consistently, and you don't just ease pain. You keep cartilage alive, slow degeneration, preserve mobility, maybe even push back the clock on old joints. Knee pain after 40 isn't a life sentence. For most men, it's simply a sign that the muscles, mobility, and daily habits that used to protect your joints aren't doing their job anymore. But the fixes are straightforward. Strengthen the right muscles. Reduce the excess load. Keep your joints moving every day. When you do those 3 things consistently, the pain fades, your confidence comes back, and stairs, squats, and long walks stop feeling like a battle. If this helped you understand what's actually happening inside your knees and what you can do starting today, check the pinned comment for the supplements we personally use for inflammation and joint recovery. It supports the channel at no extra cost to you. And if you want weekly, science-backed habits to help you stay strong, energetic, and pain-free after 40, subscribe to the channel, because your second prime is just getting started. If this video helped you in any way, even one small change you'll try tonight, leave a like. It tells the algorithm to show it to someone else who might need it. And if you want more clear, science-backed ways to protect your body and sharpen your mind after 40, stick around for more. Your second prime isn't about going back. It's about staying sharp, steady, and strong.